When we heard about the change in administration, what was likely to be, and sort of the thoughts around healthcare coming, we weren't really surprised by the impact of the quote-unquote one big beautiful bill. I guess beauty's in the eye of the beholder. Healthcare, it's not so beautiful.
The important thing going forward in healthcare will be to maintain the level of access to high-quality care that we have, particularly among people who access healthcare through Medicaid, the economically disadvantaged, and the disabled. The federal support for those programs is going down substantially by almost $1 trillion over the course of the next 10 years. For Riverside, that will mean somewhere around $750 million or plus over the next 10 years that we will lose in funding. That's a problem for us financially. What we also are equally concerned about, that if you have Medicaid now and somehow you are disenrolled because of the recent changes, we're determined to make certain you continue to have access to care. Moreover, because you will have to re-enroll every 6 months now, we will help you re-enroll. You have to do the re-enrollment. We can't do it for you, but we will provide resources and answer questions and people on site in the various clinics that have a high percentage of Medicaid patients in order to make certain that you have the maximum chance possible of keeping the insurance, and if you don't, we'll find a way to care for you in any case. How do we do that? The money has to come from somewhere. And so we've undertaken over the course of the last 2 years very significant expense control programs that don't look at reducing the number of people that work here, changing the number of people that care for a given type of patient, but rather all the external expenses that we can do more efficiently internally. And we do all the calculations from decreased federal spending on Medicaid to people no longer having that type of insurance. It's about $150 million a year. We're making good progress towards making up the additional $50 million in that number.
The one big beautiful bill is going to have a very, very significant impact on Riverside. It's going to be in the 9-figure range. Yes, it's going to be difficult, but we also feel that we're very, very well positioned to deal with the changes and the impact as it comes our way. When you look at our physical plant, our facilities, our equipment, we are well positioned to not have to spend a lot of money going forward on replacing facilities or replacing very, very expensive equipment. We feel like from a infrastructure standpoint and from a capital physical plant standpoint, we're in a great position. We're going to work as hard as we can. We've been around over 100 years, and as a management team, we're going to try to do everything we can to make sure that Riverside's around for a long, long time.